today we're going to go over Narcan or naloxone. Let's jump right into it. I have a mnemonic you can see here to help you remember some things about this medication. N, it is given outpatient as a nasal spray often, and in the hospital it's often you'll see it in IV form and used for emergency situations. A is an opioid antagonist. In other words, it reverses the effects, potential side effects of opioids. And some of those include respiratory depression, confusion, difficulties with arousal. The big one, respiratory depression, we start considering giving patients when we start seeing that their respiration is slowing down. Also, they're not as with it as we see in these patients. So respiratory depression, you also have to assess for not only their breath, but also take a look at their skin color, if they're having difficulties breathing, things like that, if they're having issues with arousal. C, chronic pain. It's important to know because this is an opioid antagonist, a lot of individuals who have chronic pain and are on opioids, you will have to end up dealing with the rebound effect after you give them Narcan. That often is that they'll have pretty severe pain after giving it, so you'll have to address that very carefully because obviously you gave it to them because of the side effects of the opioids, and now you'll have to address how are we going to address that pain. A, agitation. A lot of times these individuals, after they're given the Narcan, they'll have some agitation immediately after. And they also might have some nausea and vomiting. This is important to understand. We want to make sure that they don't aspirate, and so this is something to consider. Overall, this medication does have relatively few side effects, and another one may be that they get a little bit dizzy as well. You want to administer this slowly. It can affect the muscles of the respiratory system. If you administer too fast, sometimes it can cause chest wall rigidity, so you want to make sure to ask the patient if they're having any kind of chest pain. All right, that's it. Make sure to follow along for more Fast 5 facts and other information, medical information.